What is schizophrenia? Schizophrenia is a type of mental illness known as a psychosis. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. What are the causes of schizophrenia? The exact cause of schizophrenia is unknown, but multiple possible factors have been discovered. Factors include 1. Genetic factors. People with family members with schizophrenia have 10% chances of developing schizophrenia. 2. Environmental factors. Trauma during birth, malnutrition before birth, viral infections. 3. Chemical imbalance in brain. Low levels or imbalances of these chemicals are believed to play a role in the development of schizophrenia. Dopamine is not the only neurotransmitter associated with schizophrenia. Serotonin and glutamate have also been linked with schizophrenia. Increased levels of serotonin are associated with positive symptoms. Glutamate has been theorized to exacerbate hyperactivity and hypoactivity in dopamine pathways, affecting both positive and negative symptoms. 4. Brain abnormality. Research has found abnormal brain structure in people with schizophrenia. But this doesn't apply to all people with schizophrenia. It can affect people without the disease. How to diagnose schizophrenia. Diagnostic and Statistical Manual for Mental Disorders, DSM-5, identifies 5 symptoms for diagnosis. 1. Hallucinations. 2. Delusions. 3. Disorganized speech. 4. Disorganized or abnormal motor behavior. 5. Negative symptoms. Hallucinations. Hallucinations are false sensory experiences like hearing voices and seeing things that don't exist are the most common, but a person can hallucinate a touch, for example, bugs crawling on the skin, taste, or smell. Delusions. These are false beliefs that are not based in reality. For example, you think that you're being harmed or harassed. Disorganized speech. It means effective communication can be impaired, and answers to questions may be partially or completely unrelated. Disorganized or abnormal motor behavior. This may show in a number of ways, from childlike silliness to unpredictable agitation. Behavior can include bizarre posture, a complete lack of response, or useless and excessive movement. Negative symptoms. Negative symptoms refer to an absence or lack of normal mental function involving thinking, behavior, and perception. At least 2 of the symptoms must be present for at least 1 month, and at least one of the symptoms should be delusions, hallucinations, or disorganized speech. Although there are no laboratory tests to specifically diagnose schizophrenia, the doctor might use various diagnostic tests, such as MRI or cord scans or blood tests, to rule out physical illness as the cause of your symptoms. Symptoms are divided into 3 categories: positive symptoms, negative symptoms, cognitive symptoms. Coming to first 1. Positive symptoms. These are disturbances added to person's personality. Psychotic symptoms include delusions, hallucinations, disorganized speech, disorganized behavior, excitement. Negative symptoms refer to an absence or lack of normal mental function involving thinking, behavior, and perception. These include flattened affect means lack of emotions and facial expressions, decreased ability to find pleasure in everyday, social withdrawal, reduced speech, lack of initiative, lack of personal hygiene. Cognitive symptoms. These symptoms reflect how well the person's brain learns, stores, and uses information. These include impaired attention, memory problems. Who gets schizophrenia? Anyone can get schizophrenia. In men, psychotic symptoms often begin in the teens or 20s. In women, psychotic symptoms often begin in the 20s and 30s. A person is not considered to have schizophrenia unless symptoms last for at least 6 months. Coming to treatment. Can schizophrenia be treated? Yes. Treatment with medicines and psychosocial support is effective. Antipsychotic medications diminish the positive symptoms of schizophrenia and prevent relapses. 2 generations of antipsychotic medications are available for treatment: typical antipsychotics and atypical antipsychotics. The choice of an appropriate antipsychotic agent depends on the patient's previous experiences with antipsychotic medications, adverse effects, the patient's concomitant medical conditions, medication interactions, and the patient's preference. Typical antipsychotics like chlorpromazine, haloperidol, laxopine. Atypical antipsychotics like clozapine, quetiapine, risperidone, olanzapine. The best studied psychosocial treatments are social skills training, cognitive behavioral therapy, cognitive remediation, and